Hi, I'm Chloe de Graaf and I'm going to be telling you a bit about my study looking into radiation safety practices in veterinary equine imaging in the UK. Ionising radiation is a well-established tool in veterinary imaging, and X-rays are one type of this. These X-rays can be used for diagnosis of disease, identification of pathology, and for pre-purchase examinations in horses. Despite these clear benefits of using X-rays, there are health risks associated with them. When the X-rays interact with living tissues, the cells can be damaged, causing cancer or cell mutations. This means that to protect the health of veterinary practitioners and the equine patients, the radiation dose must be reduced as much as possible. There are three key ways of doing this: reducing the time that a person is exposed to the radiation, increasing the distance that a person is from the radiation source, and the use of shielding such as LEDs to stop the radiation from reaching the body tissues. To ensure that radiation dose to the practitioners is not too high, the dose must be monitored. In other countries of Australia, Canada and Norway, previous studies have shown that these practices are not always being used as well as they should be. The studies have also shown that there are not regular radiation safety training practices in place. The aim of this study was to evaluate use of these radiation safety practices in the UK. An online questionnaire was distributed on social media, including questions on dose reduction strategies, dose monitoring, the knowledge of participants, and their radiation safety training. There were 43 respondents, a mixture of registered vets, vet nurses, veterinary radiographers, and clinical staff. The study found that although most respondents had received initial radiation safety training, many had never received any radiation updates. The principles of dose reduction, of time, shielding, and increasing distance were not always employed frequently in practice. Respondents reported that they frequently handheld the X-ray tube, the X-ray plate, or the equine patient during examinations, thus reducing the distance that the employee or the non-employee insisting could be from the radiation. In addition, when taking X-rays in public spaces, such as yards, controlled areas were often not appropriately designated. For shielding, lead gowns were frequently worn, but use of other lead protection such as thyroid shields, lead gloves, and lead glasses were not used as often. The radiation dose to employees was monitored inconsistently, and the radiation dose to non-employees that were assisting was rarely monitored at all. 16.3% of respondents were not confident that their radiation knowledge was well developed, and more of these were vets than vet radiographers or vet nurses. These findings broadly matched findings from previous studies in the other countries and identified similar areas for improvement. This research suggests that radiation safety practices in the UK are suboptimal, and radiation doses to the workers may be higher than they need to be. As non-employees often assist in these examinations holding the horse, this would mean that the dose to these members of the public would also be higher, and if the same person is assisting with multiple examinations, this dose may become significant and the health risks may be possible. However, the doses to all of these people cannot be assessed, and the health risk cannot be determined, as dose monitoring practices are not consistent within the UK. In addition, more regular radiation safety training updates may help to improve the radiation knowledge of all professions. Although future research is needed on a larger scale, this study identifies key areas of practice that must be improved to protect the health of veterinary practitioners, members of the public, and the equine patient.